Paul Reese here, and I'm with Dr. Linda Heflin, and she runs the Heflin Family Clinic here in Stephenville, Texas. And she is our team physician, Cleanse America team physician, and a wellness educator. And I'm super stoked to have her as a friend and a part of this.
Thank you, Paul.
And we met at a raw foods class that we did here in Stephenville, and she came in just thinking she was going to take some pictures and ended up adopting some of this as a part of her lifestyle. And you want to tell them a little bit about that?
Sure. That was about 8.5 months ago at the time, and I had no idea what I was getting into. It was a raw food class with Russell, James, and Paul, and I heard their stories and actually had a chance to try raw food and learning more about raw food at the time. And within, I guess, a week, I had stumbled upon Raw Food Rehab and found Penny Shelton's website, and started picking Paul's brain because I wanted to know everything I could about raw food, and then actually became a member of kind of doing raw food myself. I started experimenting more with juices and smoothies on a daily basis and trying to incorporate as much raw as I could. I think the biggest thing that I noticed was an increase in energy that was phenomenal. Also decrease in just fatigue factor went away. I had a lot more energy to continue throughout my day to do everything I needed to do. I felt so much better. I felt like I went around smiling all the time. I was happy, and I just felt like it just showed. So from there, once I realized how good I felt about it, I thought this was something that I needed to actually take back and bring to my patients, because I thought it would be helpful for them to understand what they needed to do to take charge of their health and actually turn some of the things that they had around, or actually work on the children. We're a family practice office, so we see everything from babies to the elderly, and so I wanted to incorporate this into teaching children and their parents as well as adults, and what they needed to do to become healthy. I've continued on this. I've tried to get my family involved in it. We've got quite a few patients that are doing this now, and everyone that we've seen back, labs and things that we've been following look a lot better. I've had a few people that have actually been able to get off of their blood pressure medication, been able to get off of their cholesterol medication, and a couple people that hopefully will be pretty quickly, because they've lost so much weight, be able to get off of their diabetes medication.
That's amazing.
Yeah. So it's been a great tool for me, something that I didn't have the knowledge of 8 months ago, and I think it's kind of the missing link in what we have to provide people as physicians. We really need to talk more about nutrition to our patients, and we actually need to be knowledgeable ourselves so that we can actually help teach them. I think that for most people that have done this particular diet, more of a raw or plant-based diet, once they've done a cleanse like we're getting ready to do here for the 10 days, they've noticed that their tastes have changed. They've noticed that their energy level has gone up, their fatigue has gone down. A lot of times, if there was any issues with mood or hormone changes throughout the month for my women, those have gotten a lot better. So people do feel a lot better once they've taken this on. And the cleanse is just enough time. When you do 10 days with it, it's enough time to actually change the way your body craves food. You're going to find yourself wanting to eat things that you may not have wanted to eat in the past. And those are the things that are your go-tos. I mean, the fruits and the vegetables, the juices, the water, even the increasing water. I've had people want to drink water now that didn't used to drink water. They were drinking sodas or they were drinking coffee, and they've gotten off of that and they feel a lot better now that they've cleaned up their diet. So I think the 10 days is a perfect introduction for people to, if you're interested in making a lifestyle change, to actually take this as a serious time to be as raw as you can for those 10 days, and then see what happens after that time frame, and see if you don't find that you're craving more healthy and natural foods. And I think it's important also too, if you have any health conditions, to do a consult with your physician and talk to them about what your expectations might be. And if you don't find one that understands this yet or isn't knowledgeable about it, then you might want to look around a little bit. I think that more physicians are getting educated on nutrition. There's a lot more out there on a daily basis for people that watch any TV. There's physicians on TV that are talking about this. It's getting more in the mainstream because as a nation, America is very unhealthy. And so I think we really have to get attention to why are we unhealthy, and a lot of it has to do with our diet. And changing from the standard American diet to more of a plant-based or raw diet is definitely the way to go to reverse health disease that we're seeing in the nation, and to become you're going to feel better, much better all the way around.
Yeah, I like that.
Yeah.
So every day you have patients come into you and they deal with a lot of different things. Today we could pick a lot of different symptoms to discuss, but today we're going to talk about inflammation. Can you tell me like what you see every day in your practice and how they can help that?
Inflammation is something that I think people need to understand. It's a normal process that occurs in the body. It's part of the immune system's response to stimuli, and that can be a harmful stimuli or a helpful stimuli. So inflammation is not just an all bad scenario. It actually can be part of the healing process. But what happens when we don't have a clean diet and we do things that are more inflammatory in our diet, like animal products, saturated fats, foods with high glycemic index, foods that have a long shelf life, food additives, all these things that have to be cleared and detoxed out of our body, all these things cause a pro-inflammatory state. And that state is actually something that we can measure and we can evaluate in a laboratory setting by parameters to see how much of that is actually going on in a person's body. And I think what people are starting to realize is pro-inflammation is a lead-in to things like diabetes, heart disease, hypertension, dementia. And all of these things, if we reduce our inflammation that we're taking in, which is usually in the way of foods, but it can also come in from the air we breathe, the toxins in the air we're breathing. It can come from the water that we're drinking. It can come from products that we use on our skin and our bodies. Anything that's needing to be broken down with our body's systems can cause an inflammation state, can then put us into a state where we're going to be more likely to have diseases if we're predispositioned to show up. And the longer that you're in a pro-inflammatory, inflammatory state, the organs that are taking the biggest insult are the ones that are going to have the hit. So if the heart muscle is the one that's getting most of the insults with the cholesterol or any inflammation there, then you're going to be more likely to see heart disease, or if it's in the brain, maybe a stroke. If it's in the pancreas and you're losing beta cells in the pancreas, then you're going to be looking at diabetes down the road. So inflammation and pro-inflammatory states are really important for what the health ails are in the nation. And I think until we recognize that this is a common thread with a lot of disease states, and that we need to actually, I think, be more proactive at looking for this and educating patients on what they need to do so that they can prevent themselves from going down this pathway, this is going to help America as a whole become more healthy and help reduce our healthcare dollars and our expenditures, on top of all the other good things that are going to come about from decreasing inflammation.
Awesome. And so I like what you said, all of them kind of hold hands, and you said the inflammation can lead to heart disease, to strokes, to those kind of things. If this is someone's first time to do a cleanse, they're new to even hearing this information, what are 3 or however many just simple things they can do in their everyday life to reduce inflammation?
Well, I think the biggest thing that they need to do is to incorporate as much raw and plants, fruits, and vegetables that they can, and that can be in the form of actual, like mono meals with fruit. It can be in the form of juices and smoothies, but as much as they can do raw and leave anything that's standard American diet, caffeine behind, the faster they're going to go through the detox process and the cleaner they're going to feel. I think that people need to also remember to drink enough water. I think we need to really stay hydrated throughout all this to help process the toxins that are coming out of the organs and tissues. So as much as you can do fruits, vegetables, juices, smoothies, that's going to be the best way to go through the detox process and to get the most benefit from it in a 10-day time frame.
Cool. And then you can also do cucumber and asparagus are 2 natural diuretics that can help just reduce inflammation. So even if you're just going back and integrating into your regular life, just include that in your salads a couple times a week, and that'll help tremendously just in reducing inflammation. Well, Dr. Linda, thank you so much.
You're
Is there anything else you want to share?
No, I guess stay tuned. I'm going to be working on some education for myself and learning a little bit more about integrative medicine myself, so that I can continue to provide education for people that are interested.
Awesome. Look forward to that.
Thank you.
Yeah, absolutely.